My name is Michael Stutz and I'm a radiation oncologist. I'd like to start talking about two patients that I saw this week in follow-up, and both were 10-year survivors, and they both came back to help celebrate their 10-year anniversary with me. One was a woman that I treated with breast cancer, and I've gotten to know her so well over the years that she now works in our department. The man was initially diagnosed with very aggressive prostate cancer, and I'm happy to say that he's out 10 years, enjoying his retirement and living life to the fullest. And we had a good time reminiscing about everything that we've been through together, and it made me think about why this is why I like being a radiation oncologist. I feel like I can help patients on their journey through the cancer process, help them from the time they're diagnosed, getting over the shock of it, educating themselves on their choices, and then shepherding through the treatment, making sure they understand what they're getting into, and then helping them as they're survivors and in their recovery. My personal philosophy as a radiation oncologist is really listening to the patient. I really try and take the time to listen to what the patient is saying, listen to what they're going through, listen to their fears. And the other part of it is the communication part. So not only am I listening, but what I'm trying to do is explain their cancer, their prognosis, and what lies ahead of them in a way that hopefully they can understand. And I pride myself on taking the time and following up and making sure that they're understanding what I'm saying every step of the way. I want to treat patients that know what they're getting into, that are fully informed, and I think it makes for a better relationship between myself and the patient and ultimately a better outcome. Where I work, we focus on two things. One is teamwork, and the other is making patients comfortable. In terms of teamwork, sometimes patients look to see what doctor they want to be treated by, but really patients should be looking at the team that they're going to be treated by. I don't do my job alone. I do it with the help of all my wonderful staff that I work with. The nurse's job is important, the front desk job is important, the therapists, who are the ones that do the treatment, have special training and expertise that's necessary to bring it all about, and we have physicists and dosimetrists who do the planning. And it's really when we work together and communicate well together that I think we get the best results which the patients deserve. The other part of teamwork is myself as a physician working with the other physicians and other colleagues in the treatment team. It's becoming more and more common now that a patient needs surgery and chemotherapy and radiation therapy, so we all have to get together, make sure we're on the same page to deliver the care that we need to. I also talked about making the patients comfortable. We know that Radiation Oncology Center is the very last place that any patient wants to be. And we try and help them through the process, help make them more comfortable. Everyone who works in our department has sort of self-selected themselves. They're generally people person that are always there with a warm smile, and whatever you need, we're there for you to try and get you through the process. In terms of my background, I'm somewhat unique in that I'm a second-generation radiation oncologist. My dad practiced in Springfield, Illinois, where I grew up. I didn't learn much about the specifics of the profession from my dad. I just knew that he really enjoyed it, and he really enjoyed the interactions with patients, and I've come to enjoy the same things. I did my undergraduate work at Dartmouth College. I went to Northwestern in Chicago for my medical school, and up to Milwaukee Medical College of Wisconsin for my residency.